Welcome to the second episode in our series, Astrata Chalk Talks, where we dive into the latest trends, techniques, and strategies in digital quality measurement. And today, we are exploring the world of provider-payer data integration. Why are we starting here? Because no matter how great your analytics vision is, this transformation goes nowhere without data. And we know that developing an effective program to obtain and manage clinical data is challenging. Today's episode will try to make that task a bit easier by focusing on how to create a clinical data strategy for your health plan or value-based care organization. If this is something you really want to dig into, you'll find a comprehensive white paper and toolkit that accompanies this episode on Astrata's website. Go to astrata.co resources. In the next 6 minutes, I will walk you through a 9-step program that we have seen health plans use to create robust and successful clinical data programs. These 9 steps include defining supported use cases, establishing governance and prioritization of provider data sources, building provider relationships, developing an outreach plan, aligning provider contracts and incentives, establishing methods to obtain this data, leveraging centralized infrastructure, monitoring data quality, and assuring privacy and security. Before we double-click on each of these 9 components, I want to give you 3 North Stars that we have seen health plan leaders use in building successful clinical data programs. Number 1, don't wait. CMS continues to use 2030 as its endpoint for the switch over to digital quality. So it's important to get started and keep putting one foot in front of the other. 2, educate your providers and take them with you. That means relationship building and aligning incentives. And 3, collaborate with leaders in other departments to pool your resources and reduce redundancies. There truly is strength in numbers. So, where do you start? Start by identifying the use cases in your organizations that have like-minded leaders who need this data. This may include risk adjustment, quality, population health, and health equity initiatives. When meeting with your colleagues, find out what data they already have and how they are managing it, what costs they typically bear, what they need in the future, and what they think the barriers are in your organization. You might be surprised to find out how far others are on this journey, and you can piggyback on what they have already created. Governance is the glue that holds it all together. A monthly meeting of stakeholders can ensure that multiple perspectives and needs are considered. One of the main prioritization jobs you'll have is to prioritize your data sources. For example, what's needed by risk adjustment might be different than what's needed by quality. So as you rank providers, look for win-wins and consider volume, likelihood of participation, existing incentives, as well as challenges unique to specific providers. Building provider relationships is a continuous effort requiring multiple touches over time. Consistency and repetition are important. Early on, relationship building may take a concerted effort from senior leaders until you have more buy-in from the provider group. But you can gradually transition core functions to mid-level professionals over time. An effective outreach program and plan delivers key messages about why data sharing benefits providers and their patients, including improved patient outcomes, reduced provider workflow disruption, increased payments through gap closure, decreased audit risk, and increased data security and privacy. There are many ways to deliver this outreach, and it's a good idea to think about your audience as the entire office staff, not just the providers and leaders. Want to see what this messaging can look like? See an example brochure in the toolkit appendix. Aligning contracts and incentives is the next key success factor. Make sure that your contractual language is general enough to support your analytics vision. Specifically, you don't want to be locked into only remote manual access to the provider EHR. It doesn't scale. You'll find examples of sufficiently broad contractual language in our white paper. Financial incentives, both direct and indirect, also play a crucial role. Methods to obtain clinical data include direct integrations with a vendor or on your own, and the use of health information exchanges, HIEs, or other aggregators. Both methods have their place, and the choice often depends on factors such as cost, scalability, and control. For either one, be cognizant of the type of integration provided. HL7, CCD, CCDA, flat files, and FHIR are examples of different types of integrations, and they each have their own advantages and disadvantages. We find that health plans typically use a combination of every tool available, including all of these. You can find a detailed table in the appendix explaining each method with its pros and cons. Most health plans have already invested in centralized data infrastructure, such as a data warehouse or a FHIR server, used to support their ONC interoperability requirements. You will want to be sure that your digital quality technology fits within this existing infrastructure. One thing we have repeatedly seen get lost in the shuffle is the need to manage clinical charts. Next comes data quality, which is a critical part of any clinical data program, because if it's not attended to, your investment will gradually decline over time. Data quality problems include things like inadequate member matching or problems getting the location or provider specialty. And again, you can find more information in the white paper, including a description of some of the common data quality problems and what you can do about them. Most importantly is assuring the privacy and security of this data. And here, our recommendation is that you focus on using vendors who are HITRUST certified. And also, it's very important to provide this information about how you are securing and assuring privacy and security to your provider groups. Okay, it's a long journey with a lot of steps, but like any journey, the first step is always the hardest. In our next episode, we are going to dive more deeply into what you can do with all of this data. And we're going to start with natural language processing, or NLP. See you next time on Astrata Chalk Talks.